This is Crystal Fenn with MedPage Today here in Chicago at the American Heart Association meeting, where researchers reported good results with eplerenone in mildly symptomatic heart failure patients. For perspective on these results from the Emphasis HF trial, I spoke with Dr. Clyde Yancey of Baylor University Medical Center.
So Crystal, there are a couple of really important messages about the Emphasis HF study. First, it's yet another study that demonstrates the benefit of aldosterone antagonism in the setting of heart failure or left ventricular dysfunction. I've been concerned, as have many others, that the use of these agents, proven to change outcomes in heart failure, has been less than ideal. If that underutilization was due to having ongoing concerns about the benefits, that should be removed. And we ought to see, for those patients who already have a strong indication, a greater use of these agents that can save lives and improve outcomes.
In the trial, the drug cut the risk of death from cardiovascular causes or hospitalization for heart failure by 37% compared with placebo.
We have calculated the number needed to treat, and you can see that the number needed to treat in order to prevent one primary endpoint is 19 during 1 year, and the number needed to treat in order to prevent one death or postpone one death during 1 year is 51. So the conclusions are straightforward. In patients with systolic heart failure and mild symptoms, the addition of eplerenone to recommended medical therapy was well tolerated, improved survival, and prevented hospitalization. And of course, we need to take this into the context of the recent trials, RAS, and actually I'm sorry for these people, it was Ephesus, and this again shows a very important external validity and consistency with the other trials, and this provides compelling evidence to change medical practice.
These results should have a big impact on clinical practice for these mildly symptomatic heart failure patients, according to Yancey.
So I would say that now we have learned 3 items. We can use these drugs safely. There is a wealth of evidence that aldosterone antagonists are beneficial in heart failure, and we can even extend the population to those that have mild to moderate disease. That's really good news for many, many patients who have heart failure.
But eplerenone isn't the only drug in the class, and the results may be generalizable.
My own view is that this likely represents a class effect. There are differences in the drugs with regards to the side effect profile and the feminization that occurs with spironolactone that doesn't occur with eplerenone. But I don't think we have to parse the drugs. I think this does look like a class effect. And again, we're enthused. We still have to raise questions about exactly what's driving the benefit. Ironically, it could be raising the potassium level, the very thing that we fear that's driving some of the benefit, or it could be more complex. It just has to do with the influence of aldosterone on the heart muscle itself. But nevertheless, the benefit does appear to be real. And one reason why I think that these results can be extrapolated to the rest of the community is that they've been replicated now in 3 significant studies of very different patient populations. And so it looks like it's a real benefit, and we should begin to change our viewpoint and move from underutilization to appropriate utilization of these drugs.
So the Emphasis HF trial results may have implications across the class for mildly symptomatic heart failure patients. In Chicago at the American Heart Association meeting, I'm Crystal Fenn, MedPage Today.